Thank you, everybody, for joining this call. I'm so excited. Thank you, everybody, it is a Saturday. Thanks for taking the time to join us. My name is Ryan Hampton. I'm an organizer at the Recovery Advocacy Project. On the call today, we have various members from the Recovery Advocacy Project internal team, and you're going to hear from each of them separately in just a few moments. Stuart Smith, Aaron Kacharski, Donna Dimitrovic, Sean O'Donnell, and Garrett Haid. But before we get started with all the nuts and bolts, I just want to tell you personally why the Recovery Advocacy Project is important to me and why we are having this call today. The team on this call has worked incredibly hard to begin to create something that all of you in your states and in your communities will hopefully be able to lean on as a network and as a resource to leverage the power of our advocacy community to create some meaningful, sustainable changes in your own communities and take it to the next level, really with political activation beyond kind of the recovery advocacy that we have been seeing in the 501c3 space. And that really does exist right now in many states and, of course, on the national level. We want to take this message to your state legislatures, to your local communities, and really make a sizable impact on how we address this longstanding addiction crisis on a real micro community level in our own backyard. I'm a big reader and obviously a fan of politics, and a former U.S. House Speaker once had a phrase that many of you have probably heard, and he used to say that, all politics is local. And I think I'd like to revise that and kind of take it to the next step and say that all recovery advocacy is local, because if we are ever going to get to solutions, we've got to focus on the grassroots. We've got to focus on the bottom-up approach, a real community organizing political approach that gives all of you the tactics, the political tactics, the trainings, the ability to build local grassroots recovery constituencies of consequences in your communities. And I think everyone on this call can agree that there has been a real gap for that in terms of our approach with recovery advocacy. And it is my hope that starting today with this call and with this launch of the Recovery Advocacy Project, we're going to be able to start to close that gap. I personally recognize the need for political activation, for community organizing, for a 501c4 approach. Just last year, I was working for one of the national organizations, and we were advocating in our state legislature for a piece of legislation around sober homes and around treatment for some massive gaps that we had in the state. And at the 11th hour, the bill was gutted by the Senate Appropriations Committee. And our hands were really tied as recovery advocates in terms of infrastructure and what we could do and the extent that we could get involved because we were set up as a public charity. And that's when I really knew we needed infrastructure that was going to help support us politically. And that's exactly what Recovery Advocacy Project has been set up to do. I know that exact same problem because I travel to many of your communities and talk to you frequently. That same problem exists all around this country, in every state, in every local community. We have seen data. We have seen polling, and Stuart is going to share about this in just a moment, that says that recovery is a ballot issue. But in order for recovery to be a ballot issue, we as recovery advocates with our infrastructure have got to allow it to be a ballot issue, to be a front and center ballot issue. And once we're able to do that, I believe we are going to see a measurable increase in how our public policymakers make decisions about our communities. As you know, we're headed into an election year. Legislators listen to their voting constituencies. And the power that each and every one of you have in your local communities is immense. Part of the problem is that decisions are happening about our community, about the recovery community in those state legislatures without the recovery community, because we haven't really built up the grassroots capacity to a place where we're able to do it. Now, it's going to take some time. It's going to take some effort to do this. This is something that's not going to happen overnight. And I know that my friend Aaron, who's part of our team, and you'll hear from him in a second, he's got a great small little speech about space and pace that I'm sure he's going to share with you. But I do believe we're going to get it done. And today is really the first step in that. So I am grateful that all of you have taken some time out of your Saturday to join us for this launch. We are launching on Monday, and I want to now kick it over to Stuart Smith. Stuart, for those of you who don't know him, is an incredible recovery advocate, a person in long-term recovery himself who has really been the brains and helped spearhead this effort, and has just been an invaluable resource to recovery advocacy for so long. And we're so grateful he is here, and he's going to kick it off next. Stuart, take it away.
Thanks, Ryan. Yes, my name is Stuart Smith. I am a person in long-term sustained recovery and on the board of directors of the Recovery Advocacy Project, based here in Las Vegas. And Ryan had asked, as part of our kickoff, that we do a little bit of a discussion on some of our experience with the local process and maybe talk about how that will work with how we can all share with each other the tools to raise that local capacity to impact change in our community at our local level. And I think all of you that participated in person at the Mobilize Recovery event or digitally or have been engaged in this are interested in making changes. And one thing that we found that it was really important that you can go with a number of national organizations that are doing Hill Days and everything from CARA to back to parity legislation to the advocacy movement is older than many of us really think about when we're out shaking our fist at the sky and frustration with the forces that move us in our community. What we found that is even as changes were incrementally being done at the national level, we weren't seeing it in our community. And part of the challenge has been that the national organizations do a very good job of staying in tune with what's happening in all the committees and with the bills and how things are moving. But if we're not setting up our local communities to be able to receive the help of the work that is being done there, then it's really going to be we're going to be roadkill versus part of building bridges and building roads. And so what we really focused on here was we're not doing any congressional races. We're not writing letters to any federal agencies, to the White House. And while many of our members are engaged and I think a lot of those things are important, we were really focused on getting that connection with our assembly people, our state senate people, our local county commission, our city council, and that we really think that that's an important part of the model. What I would suggest, give me a heads up, give me a signal, Ryan, like maybe like this, or if you have a hook you can do when my time runs out. I didn't
absolutely
time when I started, and I'm not sure how much time I'm supposed to speak, but. So what we said is that we were really going to look at the time cycle of what it takes to organize a community, get our stuff together, begin making an impact in the community, and then start organizing politically and doing those things. And there's maybe, is those of us or those of you that are familiar with 12-step recovery, you don't start on the 11th step. You start at the first step. And so what we found is some of the things like the communities project that's being done. ARCO is doing some really good trainings in the communities, and you need to start building those community recovery supports together, start building your stakeholders, doing those community services before you get into, you don't just go start a PAC, political action committee as your first item. And so, again, I'll reference Aaron's famous space and pace. And I would say that, picking the order of what we're doing is kind of important, but it's really exciting about RAP and what Mobilize Recovery is doing, because the first thing you need to do is start looking at the environment that you're operating in and start doing some of that community mapping, see what your resources are, and then start bringing stakeholders in. The other thing I did want to share, and I'll share a little bit of what we did with the PAC and why that was important in the community. But the thing that was important is to make sure that we weren't driving any one agenda. As soon as we set up a political action committee, the question was, well, who are you looking to get money for? And so we were not looking for money, and we were not looking at funding for a particular program or service. What we really focused on was what we were calling recovery choice. So whether you're choosing to do a faith-based recovery path, a secular path like Sanctuary or Save Our Sobriety, or if you're doing something like a well-variety type of pathway, a MAP pathway, 12, treatment, whether you think prevention's important. We didn't want to get into, we're not driving any particular agenda, but we think that the local community and the people that are affected by addiction should have a broad array of choices, and they should be choosing those, making those choices. And so our platform was really simple.
2 minutes.
Okay, 2 minutes. Our platform was really simple. And we did this by, gathering people, and we had people that were interested in family recovery, some that were families of loss, some that were interested in recovery, some that halfway, and everybody was like, we should do more of this and this and this. But it really came down to three things: that it was about stigma, and that recovery choice, that people should have the freedom to be able to make those choices. That we thought that addiction should not be criminalized, but treated like the health issue that it is. And so justice was the second part of our recovery choice platform. And then recovery pathways. So if we are going to give people a choice, there needs to be a number of choices. And so we didn't care about the money. Let's worry about that later. Let's just give people choices. And as we see what people choose, we can talk about money after they're engaged and involved. So those were very important. So we engaged people in creating this platform, but we also engaged them in doing endorsements of candidates and bringing the candidates in and doing. And we did some public polling, which was phenomenally interesting results, which I think Ryan wanted to hear about.
Yes.
So I'm just going to give you two top line things. So we did, public polling of Clark County voters, and, it was just a regular, not our peeps necessarily. Although we found almost 16% of the people identified either directly or indirectly with us. But things that were really interesting is that 62% of voters would vote for a candidate of a different party over this issue. So 62%. So in these local elections, they're decided by a couple hundred votes. When we start moving percentages of voters, we can change outcomes of elections. This gets attention of those that are running for office in a way you wouldn't believe. But we also found like 76% believe that stigma was an important issue. This is general public kind of poll. We found that 3/4 of the voters believe that people in recovery can be of value to their families and the community. Now, 9% of voters do not believe that's the case. We've got a little bit of work to do, but I think 9% of the voters think that anal warts is a good idea too. So, I'm not sure I would necessarily read too much into that. But we found that 6 in 10 voters would support a ballot initiative on our issue. So it was a really important issue. And we started with the thing that Pew Research found that of the Trump and Hillary voters, this was the one issue everybody was really split. And we really it is a nonpartisan, bipartisan. And so being able to, whether it's a D, an R, or a giraffe, really get people moving about our issue. And I think a lot of people are really hungry to be able to do that. So where are we at? And here's my little wrap up is not all of us are ready to start doing that process. And here in Nevada, and we're not ready to kind of go, everybody's at the place that they're at. So we're starting to build some tools so everybody can begin the process of building this capacity of having a unified community that can do some things, then start pulling in some of the other allies that we might have. And but really our focus was not about anything except creating a forum. And so we didn't have an agenda that there needs to be more money for this or more whatever for that. But really it was important to bring in the community and hear what they needed and wanted. And so that's also what we're going to do with Recovery Advocacy Project and everybody that's involved with Mobilized Recovery. Our board, and I'm one of the board members. Garrett is a board member. I think Heidi is on the phone, is another board member. Alvin, I don't know whether he's on the phone or not, but we are doing a kind of our working board. I'm going to say Donna's going to tell you a little bit about some exciting stuff with our advisory board. But we also, let me suggest this is there's plenty of groups already doing things at the federal level, and that we also are going to have an advisory group of some of the federally oriented organizations that can do that. So, if you're interested in CARA, and if you're interested in kind of similar type of legislation, we're going to let you talk to some of those folks because that's kind of not our lane. We care about it, but we really care about, helping you build capacity in your local community. I think that was all you wanted me to talk about.
Yeah, no, that's great. And then I think, at the end of the day, what Stuart was saying, and then we'll kick it to Donna, was, the Recovery Advocacy Project and Mobilize Recovery, instead of telling you what we want to do, this has really been in a response to a need that community members and people in the community and the folks that attend Mobilize and folks that we talk to every single day have said they need. That they need this network, they need these resources, they need these supports and this infrastructure to build these communities of these constituencies of consequence in their own backyards to create change. Donna, I'd like to.
So we will be kind of doing that, but let's also make sure you stay. What we're going to be doing is helping you support a local effort about a local thing. Once you have that capacity, what you want to do nationally, that's great. Is we're really focused on recovery choice. And so your community needs to choose what's important there. I gave you the 3 points of our platform. And Donna's going to talk a little bit more about, what we're doing and what, is happening on that. So Donna Dimitrovic is Executive Director of Foundation for Recovery. I'm not going to give your whole resume, but Donna's been at the advocacy movement for a long time and was one of the principals at the Johnson Institute that did the original Recovery Ambassador training that many of our early RCOs were based on. We both served at Faces and Voices together. I think she was chair of the board while I was on, and then was chair of Young People on recovery, a leader in the field, and very excited to have her part of this. Donna.
Thanks, Stuart. Hi, everybody. As he said, my name is Donna Dimitrovic, and I'm a woman in long-term recovery. I'm really excited to be on the call today and see all of you here to hear about the Recovery Advocacy Project and be part of our launch. Again, I just want to reiterate what Stuart said, that Recovery Advocacy Project is about helping local groups organize, and our focus is political. And, you know, I've been involved in the recovery advocacy movement for a long time, and we have never engaged, like our end result has never been to engage in the political arena. And that's one of the things that's a little different with Recovery Advocacy Project. So I just want to give you a brief overview of what we did in Nevada. The Recovery Advocacy Project started last summer. And one of the things that we realized in our state was that we did not have recovery champions. So, you know, at city council or at the legislature, we did not have anybody that was really championing our cause. And so we came together as an organization, and Stuart really spearheaded this with a couple of the other folks that are on the board, to kind of look at where we were at the state and how we might be able to not necessarily influence any legislation, but just be able to talk to folks that were getting ready to run for office about what recovery means to us as people in recovery and family members and allies. And, you know, what were some of the needs that we saw in our local communities? And so RAP engaged on a lot of the information that Stuart talked about. And we also, as part of that, developed a recovery PAC, which is a political action committee that we're hoping, as we start to roll this out in the state and become more, build our infrastructure, that we will be able to share that information with all of you across the country, that you can also do that in your own local communities and state on the statewide level. We are not looking, as Stuart said, we are not involved in any federal advocacy issues. We have great organizations that already do that and been around for a long time. And so, you know, we don't want you to think that we're trying to compete with a national organization. We are not doing that. We are really local and state focused. But one of the things that we did determine is that we needed some advisors to help us that had been involved over the years in doing a lot of advocacy work across the country. And I just wanted to share with you the folks that have agreed to be a part of our National Advisory Council, and we are really excited to have them involved with us. John Shinholzer, who is with McShin Foundation in Virginia, and his wife, Carol McDade, who is a lobbyist down in Washington, is also involved as a member of our advisory council. Carol and John both started the McShin Foundation in Virginia, which is a recovery community organization for those of you that are not familiar. We also have Pat Taylor, who was the former director of Faces and Voices of Recovery, and she's been involved in advocacy movements for a long time, and really to help us kind of to give us some guidance as we move this forward. We also have invited Bill White, and he's agreed to be part of our advisory council. For those of you who know who Bill White is, he is a well-known researcher. He wrote the book Slaying the Dragon, which is really about the recovery advocacy movement, and we look to him for a lot of guidance as recovery advocates. And he really helped us back in the late 90s when we kind of started to get involved in this work. Also, as part of our advisory council is Tom Cordair in Rhode Island, who was a former, I think he's the special assistant to the governor on the opioid epidemic in Rhode Island, but he had been formerly with SAMHSA. And Tom Hill, who is now at the National Council, but also at the was also at SAMHSA and had been involved in recovery advocacy as long as I have, probably over 20 years. We've also invited and have as part of our advisory council, Dr. Calvin Trent, who is with the Detroit Recovery Project, and Jason Howe, who is with the National Alliance of Recovery Residences. So we also have a couple asked out.
I think you forgot Don.
I have not gotten a confirmation yet.
Okay.
So those are the people that have confirmed that will be on our committee. And we're really excited to have them, that we can sit down and talk with them and really get some guidance. Let's see what else. It really does matter that we, as people in recovery, family members, allies, organizations that support recovery, come together, collaborate. Let's not work in silos. And this is an opportunity for us all to come together, put all of our baggage to the side, and really work for the good of our local and local communities and our state recovery community. So excitement around the digital hub that's launching. Sean is going to talk about that, but I think you all are going to be really excited when you get to see our website as well. So thank you all for joining. Sean, taking it to you.
Yeah, hi everybody. My name is Sean O'Donnell. I'm a community organizer at heart. I'm also a person in long-term recovery from substance use disorder and mental health disorders. I did a lot of community organizing on the ground in the state of Minnesota, working with local organizations, different nonprofits, community groups, and lobbying associations. And that's really where I got my training wheels in community organizing. And one thing that I felt that was really lacking as a community organizer were some general tools and resources that were not only available for people who do community organizing and advocacy work, because those exist, but people in recovery who do community organizing and advocacy work locally. And so really that's what we're really excited to be bringing to communities all across the country, is this hub of tools, this resource for best practices, for guides, for actual digital tools that you can use, trainings, and of course, access to people like myself, Ryan, Stuart, Donna, and other people within your communities, so then we can share best practices and what's working. So I'm gonna go ahead and share my screen so you guys can get the first glimpse of what we're about to launch on Monday for Recovery Month. So here we go.
And for those who can't see the screen share, this is going to be available, and we'll make it available in the group.
And I'll do my best to narrate everything too. And I am also moderating the chat and admitting people to our call as I continue to join. So I'm sorry if there's a slight lag, but here we go. So what you're looking at here is the Recovery Month 2019 landing page. This is going to be available and live starting on this coming Monday, the 16th. So what we've done is we've built exclusively for Recovery Month this landing page to be able to find resources, a social media toolkit, and a place where you can go and start to take actions immediately. So we have a great overview of what the Recovery Advocacy Project is. You can go there to find more information. You can direct your networks here so people can get a better understanding of what RAP is doing locally, what our goals and our missions are. And then we get down into actions that you're able to take immediately. So some of the actions that we've carved out specifically for everybody in Recovery Month, some of these will be rolling beyond September. We have a Recovery Month pledge. You're able to join the RAP Facebook group if you're not already in that group. You're able to apply for a Recovery Advocacy Project leadership service position, either as a regional lead or a state lead. You're able to introduce yourself immediately to your state legislators, tell them who you are in your community as a recovery advocate, and encourage them and support them to put recovery at the forefront of the legislative session coming up. Tell your story and why you stand up for recovery. it's important that we continue to push back on the single story narrative. So this is a great way to do that. And then you can, of course, voice the issues that your community is currently facing. And we'll do our part on connecting people based off of similar interests and issues and barriers that we're up against. So we can, again, share resources and best practices with one another. Then we've also built out this beautiful Recovery Month toolkit that's available for everyone to use. So for the rest of Recovery Month, what's remaining, these social graphics are going to be available to you that you can use right away. So we've developed some content that you can be sharing across Twitter, Facebook, and Instagram. We also have some social graphics. We've created nearly 200 different social graphics that you can start to use across social media to help promote and support what the Recovery Advocacy Project is and what you're doing as a recovery advocate and a member of RAP. So we have different graphics for Facebook and for Twitter. You can add things to your story and get them customizable to your interests. We have a sample letter template that you're able to send out to your networks, encouraging them to come back to the Recovery Month page and take the Recovery Month pledge as an advocate. Posters and flyers that you can print out and you can bring to your local recovery rallies that are going on in your community, and have people, start a discussion around what we can start to be doing locally in our communities. And then we also have a palm card, which is a leave behind item that you can start to use when you start doing community organizing sessions or meetings or events in your community, as general information about what the Recovery Advocacy Project is. And then, of course, we provided some helpful tips this Recovery Month as we're talking about recovery and substance use disorder. Make sure that we have consistent messaging as part of the recovery movement. So we're really excited to share this with you. I'll go ahead and just give you a preview of some of the other items that we have on the Recovery Month site. And I'll show you some of these actions.
Sean, we have so many of those things because we have one for every state, right?
Right. Yep.
That's correct. So how about I show you just an example of some of these social media assets. So let's go ahead and let's say that I want to share something on Facebook. I like this social graphic, and I want to do a Facebook post about it. So here we're brought to the states collection. I'm able to scroll down anywhere here, and I'm able to find my state. And I can preview what that's going to look like before I make the decision that I want to download it. And if I want to download it, I would just go ahead and hit the other link to download right there. So again, with that community, that communal focus, that local focus, we are trying to do our part to make sure that whatever we create, whatever we develop with your input is completely translatable to your community. All right, let's just go ahead and get back to the Recovery Month page, and I can show you one of these actions that we have set up. So let's go ahead and take a look. One of my favorite ones is introducing yourself to your state legislator. Let's go ahead and preview this. So this Recovery Month, I want to send a letter to my local representative. I can go here, and I can go ahead and enter in my information. So let's go ahead and do that real quick. Let's do this. I'm just using a fake address. I'm a person in recovery. I'm interested in stigma reduction and prevention. And yes, I'm registered to vote. So let's start writing. So here we are, this crafted message that I'm able and free to edit is going to be sent automatically to both the upper and lower state representatives in my state. So here we can see, as a person that lives in a particular district in Minneapolis, as an example, this letter that I'm going to send encouraging these representatives to put recovery first and introducing myself to them as one of their constituents is going to be sent to both my state senator and representative, assemblyman. right? So that's a perfect example. What's really great about this too, that you guys get a sneak preview on, is these tools, these community organizing tools are going to be made available for state leads. So as we progress forward, as we have state leaders that are applying for leadership service positions in their states, they're going to be welcome to use a suite of tools to begin community organizing in their own communities. Also, that what will be built out on the site is we're going to have our advocacy guide, a place for people to be able to go and apply to lead. So we can just preview this quickly. So here we are. If you're unsure of which region you live in, we've included this nifty little diagram so you can find out which region you're in. And then here's information about the service requirements for being a state or regional lead, and people are able to apply. And then I'll just show you one more quick example of something that's being built out. We'll go ahead and preview this advocacy guide that Aaron will talk about next. And there are branches on the end of my screen for some reason, but okay, so here we are. So we have this recovery advocacy guide. This is going to be continually built out based on topics to help you best mobilize your communities. Here we have 3 different topics to start. So let's go ahead and just look at building your advocacy base as an example. And here we go. So here is the first guide. It's a great place to start. We've included some best practices and a step-by-step guide to start doing this work in your community. And you can navigate this using the index as well. So after our initial launch come Monday, some other great features that we'll be adding to this digital hub is we'll add a place, a secure portal for state and regional leads to be able to log into, to communicate with each other, to share best practices, and to access individualized training for leaders. We're also going to be adding microsites for each of the states. So as our state leads go out into community, listen to the communities, find out what the communities are interested in working on together, they're going to be able to populate their own actions for their communities, and that will be visible on the Recovery Advocacy Project website. So imagine when you navigate here, we'll have Recovery Advocacy Project Minnesota, and there you'll find state-specific actions and contact information for those leaders. So this is going to be a great digital hub for organizers like myself and like many of you out there. So on that note, I'm going to turn it over to Aaron. Aaron's going to talk a little bit about the Recovery Advocacy Guide, some toolkits, and a little bit more to share with you guys.
That's awesome. Thank you, Sean. This is awesome. We have people from all over the country that are community organizing minded, people in recovery from all over. I'm a person in long-term recovery myself since September 6th of 2003. And I'm a community organizer as well. I've been doing organizing work and grassroots work I've probably done trainings and work in more than 20 or 30 states across the country around organizing work. And so this to me is like in the realm of dream come true sort of stuff. I ran an advocacy program from 2010 to just about last year in New Jersey. And we had these and our whole philosophy was, what if we just had the capacity to expand locally, just think and act locally, and organize from the ground up. And it was something that hadn't really, there was a couple different varieties of that going on across the country, but it wasn't something that was just focused on full time. And so what we did in New Jersey is we actually had 10 different advocacy teams across the state. So no matter where people lived in New Jersey, we had a place for advocates to go. And we actually had 3 other ones that we managed in Pennsylvania as well. And so the advocacy program out there had expanded across state lines. And the whole sort of mentality was, if we can focus on that grassroots level and give people the advocacy tools to empower themselves, but also, we're talking about advocacy skills, about how to talk to legislators all over the state, or decision makers. It's not just legislators that we're talking to. We're working with chiefs of police. We're working with faith leaders. Anybody that was making decisions on behalf of people in recovery, we wanted to talk to. And so we're minded in the sense that we wanted community and legislative-based solutions. And when you have that sort of, there's these elements of social change that make that work. And the grassroots is one sort of piece to that. We have to have people that have the ideas and the policy ideas, be able to work with legislators to write laws. Then we need the people to actually make those votes come true. And there's that grassroots piece. And when all those three elements are working together in your state, you're going to see a lot of stuff happen. I think in New Jersey, we had hosted literally, it was hundreds of community events, thousands of local advocacy meetings. We passed laws every single legislative session that at one point, some of the laws that we were passed were kind of like pipe dreams. We were just like, oh, that's never going to happen. But it did, because we were able to have that grassroots sort of mentality and swell that put it on, that prioritized it for the people that were making decisions. The cool thing about this is that while I was doing that work in New Jersey, I was always kind of had this question in the back of my mind. And the question was, what if we were doing this all over the country? What if we gave people the capacity to tell their story impactfully? We gave people the tools to organize a town hall meeting. We gave people the tools to do a letter writing campaign. And that's what the Recovery Advocacy Project is really all about, is building that structure, not only with the leadership, with the regional and state leads that you're going to hear Garrett talk about in a minute, but also the structure that Sean was just talking about is equally important, that piece that connects all of us, that Recovery Advocacy Project website that can be the hub for social media activity, can be the hub for signing up advocates. It's when people can sign up for the Recovery Advocacy Project, and somebody in Greenbow, Alabama, or whatever, or Anchorage, Alaska, it doesn't matter. We're able to sign those people up, and we're going to have state and regional leads that can guide those advocates. And so it can be, you never know what prompts somebody to get involved with this work. It's not just people in recovery, it's family members, there's allies all across the board that they're waiting to be talked to, they're waiting to be mobilized. And the Recovery Advocacy Project is a way to do that. So I'm going to talk a little bit about the piece about, what if we just, we're doing this all over the country. One of the things that we talked about, we need to write an advocacy toolkit to guide people through the process. So if Joe Smith out in Chicago, Illinois, wants to do a town hall meeting on collegiate recovery programs or whatever, then he's going to have the tools to do that. So Sean talked about the advocacy toolkit. There's 3 pieces up there right now. The first piece that I thought, and these pieces of the toolkit, those suggestions all came from the Mobilized Recovery Conference out in Vegas in the summer. And so we have a laundry list of different pieces of the toolkit that are being worked on and are being published over time. We're going to work to release them periodically, so it just keeps people coming back to the Recovery Advocacy Project website, because there's going to be these tools that just keep going. if there's something that you don't see on the toolkit over time and you want to learn how to do it, you contact us and we'll be able to work on that for you. And that's the beauty of this, is that, what you're working on in your town is going to differ from what somebody else is working on all across the country. And so if we can give somebody those broad sort of community organizing skills and have trainings that are ongoing that people can sign on to, either watching live stream or if we come to your community, that is a game changer. And that's exciting. And so the toolkit I'm really excited about. The first 3 pieces on it, they're all how-tos. The first one is how to host a monthly Recovery Advocacy Team meeting. Like I said, in New Jersey, we had 10 of those a month, and so every month there'd be a team in Camden County, New Jersey, that between whether 5 people showed up or 20 people showed up, that was the advocacy meeting every month. And we got a ton of stuff done because we were able to give people the platform to say, hey, what is going on in your community? What's going on in your neighborhood? And how can we work to find community-based solutions as a team to address that? And so that's the cool thing about this, is that, we want to celebrate the uniqueness and the diversity of the communities across the country that we're organizing in, that we're mobilizing in. And so the first one, we wanted to make sure that hosting a monthly Recovery Advocacy Team meeting was the first one right off the bat. And then the second one is really for both individuals and for organizations. It's about how to build your advocacy base. And then the second part of it is how to sustain it, right? Like, how do you keep people engaged and keep people motivated and moving on? And so that's the second piece that's on the advocacy toolkit that we're releasing this month for Recovery Month. And the third piece I think is really important as well. It's how to create a recovery asset and resource map. It's incredibly important to know what is around you and what's not around you. What's available, what's not available. And one of the things that we had people do from that attended the Mobilized Recovery Conference is we had them work on these local recovery advocacy and resource maps. And those are going to come in handy, once we have the state and regional leads to organize, because we're going to be able to say, oh, this is what's missing in Mississippi. So this is a campaign that we can create to address that together. So there is, a couple people have quoted me before, as the call's been going on, as space and pace, and that came from the Mobilized Recovery Conference. And the reason why we say that is that, as long as we're creating the space to give people these tools and opportunities to knock down doors, to open up windows, to make some noise in your communities, but we're doing it at a pace that is responsible. So we're not just going to say, hey, share your story, but we're not going to give you any language on how to do it, right? It's like or go do a town hall with decision makers, but we're not going to give any guidance to do it. So we're working to roll that out over time. So we're doing this in a way that, for people that have been doing the organizing, like myself and a number of people that you've heard from for a long time, we want a new generation of advocates to say, you know what, recovery advocacy is an important piece. My own personal recovery is important, but recovery advocacy as a whole, if I can advocate for a recovery high school in my state, that's going to help people that I'm never going to meet. And that is cool. That sort, part of the localizing, the thinking and acting local is about culture change. If I'm going to walk down Main Street, I'm in South Carolina. I'm in Myrtle Beach, South Carolina. If I'm going to walk down Main Street in Myrtle Beach, South Carolina, and I see the bars, I want to be able to walk down Main Street and see the recovery community organization or the mental health facility or detox centers or whatever it is. I want to see that there too. And I think that part of this thinking and acting locally is about culture change, that we're not going to be quiet anymore. Our friends are dying. Our friends are dying, and this is urgent. People need to understand that the fact that there is a crisis right now in every single community across the country, that is a huge problem. And if recovery is a solution and recovery advocacy is a solution, then I'm going to do everything I can to share what I know about grassroots organizing, about mobilizing people. My face hopefully will become familiar to all of you. I'm going to be doing some trainings for the Recovery Advocacy Project. I'm excited about that, whether I come to your community or whether you see me on a live stream. We're all doing this together. And so I'm psyched. If you can't tell, I'm kind of on a roll here, but I'm going to pass it on to Garrett, who's going to talk about applying for state and regional leads, which is really important. I know a lot of people that went to the Mobilized Recovery Conference in Vegas. You know, you arrived in the first couple hours, you're like, what am I doing here? I don't know if I belong here. And, you know, over the weekend that we met, it was really cool. I got to see people come out of their shells and be like, yeah, this is why I'm here. I do belong here. And there are a ton of people that didn't go to that conference that want to be empowered, that want to organize, that have volunteer experience, that have community organizing experience, political experience, whatever. They're good at IT stuff. They're good at graphics, whatever. We want to take all these skills and talents of people in recovery all across the country and combine them and see the magic that happens. And so we're going to do that, but we're going to do it in an organized way. And so Garrett is going to talk about the leadership organization that we're working to build over the next month. Go ahead, Garrett.
Great. Thanks. And thanks, everybody. My name is Garrett Haight, and I am also a person in recovery, and I am extremely excited about this. Just real quick, about 4 years ago, I was one of those people that didn't know why I was here, didn't know what I was doing. And I was in that same place, though. My friends were dying, and I didn't know what to do about it. Ryan had suggested that we need to organize and get registered to vote, and I didn't see the value in that because I'd never been involved in this before. But what happened is that we went around and we organized our local community. We got pretty much everyone between the age of 20 and 25 to register to vote for the first time, like myself. And what happened is that we were able to influence the election. We were able to organize the community. And before you knew it, we were working with our state representative. We were writing legislation. And then immediately after that, city officials started wanting to hold listening sessions and meet and greets at our sober living because they realized that there was a voting constituency that they had not been talking to. And it really showed the power of local community organizing. And it kind of propelled us into why I'm so excited about what we're trying to do and accomplish here. And just thank you to all of you for participating, because without you, this wouldn't work. So real quick, just some key points on these applications that I want to stress. One of the big questions I get is, can I apply if I was not at Mobilized Recovery? The answer is absolutely yes. We are casting a wide net, and we encourage everyone to apply for these positions. We encourage you to reach out to your networks and encourage others to apply for these positions. We realize that we're not talking to everybody, and that's why it's so important that we rely on you to spread that message. So the leadership applications will open on Monday. Please do not log into the site and apply because we might lose your application. So please wait till Monday. It'll be a 30-day open process. And like I said, anyone's able to apply. And then we will choose and select state and regional leads within 60 days. So we're targeting this to be a 90-day process. It'll be on the site, but a few things for state leads. real quick point also is that this is not a singular state lead. We would like to have multiple people working in both state and regional positions because obviously one is better. It's better as a team. But like the state leads, regional leads, like you'll be responsible for identifying potential partners. Stuart was talking about it earlier, environmental mapping. I don't live where you live. Ryan's in California. Stuart's in Nevada. We don't know what your community needs as like you do. So that's really important for these people. You're kind of going to act as like the glue for your state or for your region, letting us know what's going on, what you need, what kind of legislative issues are happening. And we really are encouraging you to bring people under your tent and build that base. And what Ryan likes to always say is like, we need that button. When something happens or something needs to get done, there's a button we can push or we activate our people and actions can happen and we can, get things done. So when you go onto the site and you look at the state and regional applications, you'll see a list of, what is necessary and what we're asking. The state lead is going to be a service commitment, if you would, that we're asking for a year's commitment. Regional leads will be 2 years. Moving, a lot of it's going to be the same, knowing what's going on in your communities, encouraging people to advocate. Regional will be a little bit different because we're going to be asking you to kind of understand the environment of all the states under your region, and you will be responsible for maybe, organizing conference calls, bringing all the states together into one hub and then relaying back to us of what's needed, what's happening. So we're really relying on you to feed us the information. So then, like Aaron said, we're giving you the correct tools and the correct ways to, form town halls or listening sessions or advocating for different pieces of legislation. So really that is what those will entail. I would really like to also encourage everybody when this goes live on Monday to share far and wide, use the social media toolkit that Sean has laid out for you earlier, and just build that base, build that constituency. And we're going to be with you every step of the way. We're going to do this together. This is a partnership. We're not trying to dictate what's going on. We want you to be as much involved as we are. So again, thank you. And I think, Ryan, is that time for me to open up for questions?
Hey, Garrett. I did have somebody the other day asked if they could apply for both the regional and the state at one time, and my answer was yes. But I figured that might be a good one for you to answer.
The answer is yes.
If they can apply for both, if people can apply for both.
The answer is yes.
And I just want to tack on to what Garrett said and the importance of kind of like this regional state and the leadership focus and why we're organizing this way, right? So a lot of you are familiar with campaigns and political campaigns, and you can see it happening in your communities now. What do these campaigns do to win an election or to win an issue, right? They literally have community organizers, regional organizers, block by block organizers, county organizers. They have county level meetings. Yes, you see them on a national level talking about their issues and on television, but guess what? Who loses elections? Who doesn't make it? The ones who aren't organized at the very granular level. So that's really what we're attempting to do here, and what we will be doing through Recovery Advocacy Project is like we have that presence on the national level. We know that. We talked about that at the beginning of this call. What we're missing really is that granular block by block, county by county, state leadership, organizing your neighbors and your friends. And when we do that, real change happens. So I hope that everybody is able to, that is comfortable on Monday, logs on, signs on, joins, puts in their application. Garrett went through the process. We're going to be here as a team to answer questions for you. So feel free to reach out to us. But that being said, we are going to open up the call to a few questions. I just want to be conscious that we're not going to be able to get to everybody's questions because it is Saturday, but we do want to answer all your questions. So if there's a question, if you aren't able to get your question in, feel free to email Garrett at recoveryvoices.com, Ryan at recoveryvoices.com. Aaron at recoveryvoices.com.
Also info at Recovery Voices.
Or info at Recovery. I think the team is probably not happy. I put all their email addresses out there, but now you have them, and we're super accessible. So feel free to reach out to us or use info at recoveryvoices.com, and we will get back to you soon.
Let me also suggest one thing that both Aaron and Garrett referenced. So even if you have a travel schedule as busy as Ryan's, and you are speaking everywhere all around the country and can't make the commitment to be a state or regional lead, go ahead and fill in one of the applications, and just know, because we do need volunteers to do things besides just that. And at the end of the day is that we're stronger together. So let us know what you can do, what you want to do, what you have time to do.
So I'm looking at some of the questions coming in. I just want to say to one of the person asked if they're confused if there's just one state leader. Montana's a huge state, too much for one lead. There will be more than one state lead. So we will hopefully have multiple leaders in each state. If you want to ask your
Ryan,
questions.
you want me to give
go for it.
how to do it? Okay.
Yep.
So if you have called in on a phone, you'll hit *9, and that'll prompt us so we can open your line so you can ask us a question. If you're using the app, the Zoom app by phone, you'll see a little more at the bottom right-hand corner. Click that, and you'll see something that says raise your hand. That's the same thing as asking a question. Click that. We'll be prompted, and we'll know. And then with desktop, where you see in the middle, it'll say participate. Click that. You'll see a little button that says raise your hand, again, prompting us that you're wanting to ask a question, and we will unmute your line. And those are the 3 ways you can ask questions. Go for it. It's open.
All right. So we have a question that's coming in from Brett Bramble. So I'll go ahead and unmute him.
Hey, Brett.
Hey, Brett. He's still mute. Oh, there we go.
Okay. Can you hear me now? There we go.
We can.
Nice band, Brett.
Yeah. All right. So I was in Vegas and applied for the state lead there. Do I need to do it again on the website come Monday?
Yes. So that wasn't an application on, that was actual an expression. So that we collected that information to see who would be interested in applying for a state lead. So yes, this is a different application process. You would need to apply separately.
Yep. Thanks.
Good to see you. Next question.
I'm waiting for questions to come in. We don't have anyone else writing their hand
No more
yet.
questions? Okay.
Someone in the chat is asking, Colin actually from Minnesota is asking, what exactly are you looking for in a state lead? And this is laid out on the website, but Ryan or Garrett or Aaron, does anyone want to talk about this quick?
Aaron.
Yeah.
Or Garrett?
Yeah, I could. So really what a state, so you'll be able to see this on the website, but it'll be about identifying potential partners in your local community or your state, knowing what's going on legislatively, building that base of advocates so you'll be using the tools that Sean has laid out, whether that's the Palm Card or the social tools or the posters or whatever it may be where you're at community events, but actually bringing people under your tent as the lead. And then, and then also, because we're going to have multiple leads, we do know that some people have different skills, right? So maybe one person is more, knowledgeable about community organizing. Maybe somebody has more computer literacy skills, because this will require some sort of computer literacy, whether that's going into Action Network or using the tools that we will give you ongoing training for. We will definitely require to follow a code of ethics. And then just be willing to, participate in these ongoing trainings, working with us, and just, good
Garrett,
communication organized.
And I want to kick it to Aaron really quick too, because a lot of this is explained on the website, but I think Aaron, if you could explain like what the real kind of the role in the model that coming out of New Jersey, what those leads actually did as well, because it goes a lot more in depth, I think, than what's just written on the website, and just on the ground level.
Yeah. I mean, like if you want to have your finger on the pulse of your communities in your state, so it's like a lot of us like have our opinions of like what we'd like to see in our state, but that's not what the state lead's about, right? It's about working with
the grassroots organizers working with your other advocates to get a good grasp of some of the commonalities that are happening across the state, being able to identify legislative and community-based solutions, being able to put together a campaign that addresses those in an organized sort of fashion. I think that once people kind of get into like the online sort of engagement, and you're going to be able to see how to actually create campaigns in your states to address some of the issues that are going on there. I think a lot of this will kind of like answer itself. But as far as like the roles and responsibilities of the state lead is, to basically collect information and have it go from the ground up. So your regional leads knows what's going on. So our organizing team understands what's going on in the state. If there are new advocates in the state that sign up for the Recovery Advocacy Project, it's welcoming them and bring them into, whether it's you're doing conference calls for state advocates or however people choose to do it, there's going to be communications through all the state advocates. And so we're also going to give people access to information of who's in your state and what they care about. When people sign up, it's really important that we ask them, what motivated you to get involved with the Recovery Advocacy Project? Because if we have a campaign on naloxone expansion in Kentucky, and we want to send out an email to every single advocate that cares about that expansion in Kentucky, the state organizer can do that sort of stuff. And so it's really important to kind of like have a good grasp of like online organizing, but people organizing, being good with people. And I think that, if you have these ideas of, some of the solutions that are important in your state, and you've done the recovery resource and the recovery asset map that we were talking about, and you're able to look at, what's here and what's not here. But it's part of the responsibility for the state leads is going to be keeping people engaged, making sure there's stuff for people to work on, giving people updates on the campaigns of, if you wanted to get 100 or 500 signatures on a petition for something across the state, and you're at 250, we're going to ask that the state leads are responsible for pushing that, like getting those victories across.
And Aaron, I just want to,
they're basically like the ones making noise, making sure that everybody's organized and making noise in the state. And at the same time, reporting back up to the regional leads.
And Aaron, we have a few other questions as well from callers. Do you mind if I move on?
Yeah. Yeah.
Or Ryan, did you have something else that you wanted to add?
I did. I wanted to put a point in there. Like when you apply for a lead, we're not just going to say, hey, you're a lead, go get to work. There's actually going to be trainings for state leads and regional leads. So a lot of this, all of these questions you have, like these are just kind of baselines. And we will be addressing that. You will receive the appropriate training. I have been looking at the questions also coming in. Some of them have been asking, will these trainings be done virtually or in person? It's going to be a mix. And it's obviously some of this depends on funding, right? So it's like we have been able to do a lot of this virtually, and we've been able to do some in person. Some states, yes, we will be coming in and we'll be spending time there. And we'll be helping you build that infrastructure. For other states, we'll be doing virtual. It's going to be a mix, and we're going to do our best to really kind of equal that out as well. So I know that answers one of the questions. The other question, before I forget, was there was a question about where we're citing the data that Stuart had originally brought up in terms of the polling. Interestingly enough, I as a political expert, as a political person, like there hasn't been much polling done on our issue. The recovery PAC is the source for that. Stuart, if you want to take that on real quick. I mean, this was a scientific poll that was done.
Yeah, that was, but so I would say that was Clark County. So it's Clark County voters. There was 1,200, actually, let me see, it was 1,100 something. It was kind of standard poll that they do here in Nevada. So it was commissioned. It was 1,172. It was a mixed mode survey, 57% IVR, 26% live landline, 17% live cell. The Pew Research was a national poll, but what we hope is as you build capacity locally, and we can work with you to either you have some funding to do some polling here in your local community, or we've got some national groups that want to help support some of that. So all politics is local, so local mileage may vary, but what we found is really amazing results. This is a cross-cutting issue, and that both D's, R's, and I's all support people being able to get help and not die. But is like I say, is the 9% of people? I mean, should Narcan be universally available? Over 9% say no, let them die. So but that's some of the stigma that we've got to fight. No, I mean, there's literally a segment of our population that says no, our public service people shouldn't be. They're killing themselves. Let them die. And, hey, we're fighting for life and death for our peeps. And, but, is there's more strength together. But, what we found with our public polling, and one thing that we found was some of our questions about problem solving courts and, kind of that solution did not translate well into the public polling. So we ended up with high percentages of unsure. So we're actually going to be doing some more polling in Clark County, our rurals and north. So our poll wouldn't translate to be able to go take nationally and say everybody in Reading, Pennsylvania believes this. So, but let's work together so that we get some really good polling nationally, because I think this is really an important issue, and I think it will be helpful to get our policymakers to sit up and listen to what we have to say.
The polling has been really critical, and hopefully we'll be able to expand the polling too in the coming year. Sean, is there another question?
All right. Yeah. So we have a few other callers that have been calling in. Again, this video will be posted online. So I'm trying to answer questions in the chat as we're going through. But this video will be posted online so you guys can come back and reference some of these questions. So I have a caller here. You're going to know when you're chosen because the system will tell you that you're unmuted. So, all right. We have a caller here. Go ahead. What's your question?
My name is Carol Terwilliger. My question is, will you be creating a roster so that we know who all is involved, as well as their contact information, including state leads, regional leads, and so forth?
Thank you for that question, Carol. One of the things that we will be doing is so we're going to be relying, as you build out your local community, that is going to be kind of up to our state and regional folks to make those decisions in terms of like what information is available. I assume that within whatever state you're calling from, that you're going to want to share that information freely and whatnot. For right now, our main kind of method of communication has been through the Facebook groups. But if you're asking if we're going to be publishing kind of on the website, the state leads and the phone numbers, right now we are not going to be doing that as of yet, but we are trying to create an infrastructure where that information is available kind of like within your local community and on the state level. But many people have asked that same question. We are trying to figure out kind of a way where we're able to share that information without kind of blasting everybody's phone number and email around. There's going to be a private section within the website that you'll be able to log into as a state or regional lead or as a member of your state's Recovery Advocacy Project, where you're going to be able to communicate with people through chat rooms and whatnot, Google Classrooms and other means on the website. So we do understand the value and the need for people to connect. We've just had different it's very hard when you have such a large group of people, and certain people don't want to share their personal information. Other people do. So we're trying to find a way where everybody can connect in some form. And I think we're getting there. Thank you so much for your question.
All right. So we have another question from another caller. So I'll go ahead and unmute them. All right. Go ahead. Ask your question.
Hi, my name is Angela Dumang. I'm here in Southern California. And some of my questions were actually answered just by the previous, dialogue with regards to making contacts with alliances and, the prospective vetting of those contacts. So I imagine that at any capacity, whether you're volunteering or a state or regional lead, I imagine when you start to find potential resources to network, they have to be vetted, up the chain to determine, is it feasible? Is it doable? I guess my question is the vetting process of potential, because I see so much potential to, partner on the ground with so many different, exciting partnerships and exciting, programs that sort of currently exist that could help with so much, just the connectedness of the programs. I was just in DC where the 50 top nonprofit influencers were recognized, and I was very disappointed that, mental health and addiction and recovery was not in that category. So I would love to see that change. There was a lot that was very, very important, but I'm hoping that someday some of the influencers that are recognized in, at that level do become, are the advocates for recovery. So I guess my long-winded question is the vetting process, of the potential partnerships. Again, some of it was answered, I think, by the leadership saying that there are going to be tools, and I suppose some contact, some just leads and some contact information to follow up on. But how much freedom, I suppose, do members have to just go out and do some prospecting just to find really strong partnerships? It's so necessary here in California, Orange County, everywhere across the
Angie,
I take that one real quick.
Yep.
Because let me share with you the things that Sean was showing you to be able to do those actions. There's a lot more of those actions that it's not just our webpage. We actually have subscribed to the Action Network to be able to do that. So all of the state leads and regional leads are going to be able to see all the stuff that you're being able to do and build those connections within your network. I would say, is that in your local community, your partnerships are going to look different than even somebody down the street. It's going to be who's ready to act on our issue now. And I think you'll be surprised by some of the people that want to be partners and will partner up with us. But it's going to look different in Myrtle Beach, South Carolina, from Southern Cal, from Reading, Pennsylvania to Muzzloo, Missouri.
And I would just, I would add on to what Stuart said. This is one of the beauties of the Recovery Advocacy Project is, this is also one of the reasons we need our regional and our state leads and people like you, Angie, in your community, because we need to rely on you about what is best in your community. I just want to, one of the things for me as someone who, we share a backyard, literally, where we're at in Southern California, was a lot of other groups will come in and tell me, hey, here's who you can and here's who you can't work with in your community. And, we're kind of limiting and telling kind of us what to do in our own local communities. And what I would say is, like, you have your ear on the ground way better than someone from another state or from Washington, D.C. to tell you, who you should be or what you should be doing in your community. We want to empower you with the right tools and trainings and resources to be able to vet those people in your own community. You can rely on us as a resource, and we are going to, help you and train you and hopefully bring you up to scale with that. But the idea here is to empower local advocates to make these decisions what's best for their community, right? And that, I think, is what is very uniquely and fundamentally different about this approach. So thank you so much for your question.
All right. I have one more question here. All right. Go ahead. You're online. Hello?
Hi.
Hi. You're online. Do you have a question?
That's you, Christy.
Oh, it's me.
Hi, Christy.
Can you guys hear me?
We can see you.
It said that my hand was like done. Quick question. How much interaction are we going to have with the different state leaders? Because I know like maybe from one state they've done something. And if I'm trying to do that same thing and not knowing that, oh, these people did it, but to be able to exchange ideas and get resources and help from each other.
A lot. I would say this is a network. This is a network that the state leads, regional leads. There's going to be plenty of space, plenty of opportunity to coordinate best practices, ideas, what's happening in other states, how it can be modeled in different states. You know, taking new innovative approaches. There's going to be a ton of information sharing and coordination. We want to make sure that we're sharing, you know, these resources, these ideas, these innovations across the board. So there is going to be plenty of that. I mean, I would just say, you know, a lot of this work, I just want to, you know, I don't want to go overboard on this, but I have to tip my hat to the state of Nevada. Like the Recovery Advocacy Project, the Recovery PAC concept, like this entire model of organizing, while we're now looking to scale into other communities, support other communities, and do this in different states to build up these, you know, community and state level advocates. We are taking information and best practices from the state of Nevada to scale out. So, I mean, you know, we hope that happens across multiple states, leaders, and communities.
Well, and let me say this, though, is in some ways what Aaron did up in New Jersey in terms of organizing his statewide network is a lot better job than we've done here. And they were doing cool stuff in Oregon and South Carolina. I mean, so how do we kind of disseminate all the best practices without it feeling like you're drinking from a fire hose? So partly the state leads, and then the regional leads. One idea we had talked about is maybe each regional lead does a little quarterly newsletter with some bullet points on kind of some of the best ideas out of their region. And then somebody that goes, hey, they can go do a deeper dive. So we've looked at some ways to be able to make sure that we're not just dumping 500 documents into a thing for you to get lost in, but put it in a way that's really useful for everybody.
And with that, I want to, because we've been going on for almost, first of all, I just want to say how fascinating it is to me on a Saturday that everyone has hung through this has been a 90-minute launch call. If anybody has any other questions, please email to info@recoveryvoices.com. I am super grateful for everything that each and every one of you are doing in your communities, for your excitement to be mobilized around Recovery Advocacy Project, for your excitement to really make a difference, to kind of take this to the next level in terms of recovery advocacy. And I look forward to working with you. I know I've met many of you, and whether it's digitally or in person, I'm just looking forward to this journey and this work ahead. Stuart, did you have we have a few moments before we close the call. Do you have any closing thoughts?
No, I just thanks everybody for participating. Is that I think we were up to about almost 80 people participating with this, and a lot will participate otherwise. And again, have patience. We're all, kind of trying to juggle a couple of things. We're trying to kind of give you tools that will be useful and helpful. And I will tell you that Aaron is sandbagging a little bit. He talked about a couple of tools that are going up right away. Rather than overwhelming you with everything, he does have a number of tools. They've talked about doing the master's class. So we've got a lot of stuff coming down, but we also want to engage you to do videos, classes, tools. And so it's kind of exciting to be able to do that. But I would also encourage you, what we're doing here in Nevada is going to look different than everywhere else, and there's probably not a wrong answer. One thing that we are really focused on, so all the community organizing, all the advocacy, kind of all the education you wanted to do of people locally, as you start getting into politics, we'll make sure that we're helping you with some tools. So if you're involved with a 501c3 or a nonprofit, we want to make sure that we give you the tools that you don't kind of jeopardize funding or kind of run a skew of campaign finance. The good news is most of those rules are black and white, kind of or you can measure with math. So we can help steer you to stay on the right side of the angels without getting into trouble. So have patience if you're not running a robust political action committee tomorrow. There's a lot of steps to get there. And that's all I would say.
Thank you, everybody. Just to remind you, info@recoveryvoices.com. If your question didn't get answered, we will be as quick to respond to you. And more to come. Launch on Monday. Please, everybody will receive an email that was on this call once we launch with the social media toolkit. I'm a big fan of social media. I don't think that's any secret. Please share this toolkit. Ask people to sign up, ask people to get involved, tell them what you're doing in your state, share your state-specific images, let them know that you're going to be a part of this movement. Without you, we can't do this. And with that, I hope everybody has a safe and incredible weekend. And again, thank you for your time today.